Hello friends, welcome again to Dr. Osman's Friends. Hope you're all doing well. Today we will talk about heart complication called as cardiac arrhythmia. A normal heart rate is 50 to 100 beats per minute. Arrhythmias can occur with a normal heart rate or with heart rates that are slower. As the name suggests, cardiac arrhythmia, there is an issue or the problem with the conduction of rhythm in heart. When the heart rate is low, that is less than 50 beats per minute, then the condition is called as bradycardia. And when the heart rate is rapid, that is 100 beats per minute, then the condition is called as tachycardia. If you have a glance of causes, then arrhythmias may be caused by many different factors, such as existence of coronary artery disease, electrolyte imbalances in your blood, such as sodium and potassium level, changes in the heart muscle, or injury from a heart attack. An arrhythmia can be silent and will not show any symptoms. A doctor can detect an irregular heartbeat during a physical exam by taking the note of the pulse or through an electrocardiogram. Now, if you talk about the signs and symptoms, the symptoms of arrhythmia can be palpitations, pounding in the chest, dizziness or feeling lightheaded, fainting, shortness of breath, chest discomfort, weakness or fatigue. To diagnose a heart arrhythmia, doctors will see the symptoms and take a charge of medical history and conduct a physical examination. Doctor may ask about heart monitoring test for conditions that may trigger arrhythmia. An electrocardiogram measures the timing and duration of each electrical phase in a heartbeat, whereas echocardiogram, which is a non-invasive test where a handheld device, that is transducer, placed on the chest uses sound waves to produce images of your heart size, structure and motion. If doctors does not find an arrhythmia during those tests, he or she may advise to go with other tests such as stress test. Some arrhythmias are triggered or worsened by exercise. During a stress test, the patient is asked to exercise on a treadmill or stationary bicycle while the activity of heart is monitored. If the doctors who are evaluating determines if any coronary artery disease exists, that may be a cause of arrhythmia, and the patient may have difficulty in exercising, then doctor may use a drug to stimulate heart in a way that's similar to exercise. Now, if you talk about the treatment, if arrhythmia is confirmed in patient, then treatment may be important. If slow heartbeats, that is bradycardia, occurs, then doctors often treat them with a pacemaker because there are not any medications that can reliably speed up the heart. A pacemaker is a small device that usually implanted near the collarbone. One or more electrode tipped wires run from the pacemaker through the blood vessels to the inner heart. If heart rate is too slow or if it stops, the pacemaker sends out electrical impulses that stimulates heart to beat at a steady rate. For fast heartbeats, that is tachycardia, treatments may include medications. For many types of tachycardia, doctors may prescribe medications to control heart rate or restore a normal heart rhythm. It is very important to take any anti-arrhythmic medication exactly as directed by the treating doctor in order to minimize complications. If the patient have atrial fibrillation, then the doctor may prescribe blood thinning medications to help keep dangerous blood clots from forming. In some cases, surgery may be recommended for treatment of heart arrhythmias, coronary angioplasty or coronary bypass surgery. If the patient is having severe coronary artery, in addition to arrhythmia, doctors may perform coronary bypass surgery. This procedure may improve the blood flow to the heart. So friends, I hope this video is informative to you all. We will meet again soon with another informative video. Thank you.